We'll introduce the team and provide an opportunity for everyone to share who they are. So if you're on the call, we invite you to share your name and agency or role in the chat box so that we can kind of do a roll call on who is able to join us today. And we'll have lots of opportunity to interact throughout this meeting today. In terms of today's agenda and rollout, we'll be spending just a few minutes at the beginning getting grounded and kind of recapping the 4-month planning process that we had from September to December, thinking about what the Resilient Guilford Network should be for Guilford County based on your feedback, based on your guidance and expertise around what's needed in our community. We'll look at our action teams that were recommended from your feedback, and we'll begin to form those action teams and move into some breakout groups where you'll be able to self-select into whichever action team is of most interest to you. And we'll do some conversation and beginning work in those action teams. And then we'll come back together and connect on what's next for the RGN process. One piece of level setting that we would want to make sure to do as we roll out the formal Resilient Guilford Network this year is to continue to just highlight the fact that this particular network is focusing on community level resilience. So community level resilience is a little bit different than individual level resilience and family level resilience. Community resilience really is at the community and systems level. So we're really looking at community and systems level changes here. And we know from the science that resilience can be built and that we can support and grow and facilitate resilience across communities and across systems. And so we don't plan to do this instead of addressing trauma, but both and. So how do we support and build trauma-informed communities and systems and also facilitate resilience across communities as well? So with that being said, I'm going to pass it to Mary Herbenek, who is going to be driving the Resilient Guilford Network, and she'll take it from here.
Thank you so much, Kelly, and good afternoon, everyone. Happy New Year. We are all so delighted to be back together with you after a little bit of a break, and hope that you had good holidays and a little bit of downtime for yourself as well. So as Kelly said, we're really working at the systems level with the Resilient Guilford. And what you see on the slide right now is the definition of what Resilient Guilford Network is, and by implication, what it is not. So it's action oriented. That's a really important thing as we're doing collective work together. And full of collaborative leaders with the goal of promoting safe, secure, and nurturing environments for all. And that all piece is really important, especially as we're looking at building more equitable systems. We also draw on the interconnected social networks and coordinated, easy to access, comprehensive resources so that we can help the community of Guilford County thrive. And as Kelly said, working at the community and systems level. So we know that there are many levels of resilience, and this group is focused on the system. We can move to the next slide. So we as a group have done a lot of work over the last 4 months about what we are and what we are not as a collaborative. And so we co-developed collective values that you see, and there are 8 values listed on the page, each with a very in-depth definition. Those are in your notes from the last meeting, but this is what collectively we're going to hold ourselves accountable for. So trust, transparency, and accountability is key and critical, and you lifted that up. Making sure that we are focusing on equity and inclusion, and that we have diverse representation across this collective. Family voice-centered and client-led is another key piece of this. We know that we will miss the mark when we're doing change work in the community if we don't have representation at the table from families and individuals who are experiencing the issues. Data-driven and the trauma-informed lens, so we can do both of those things together. As we said, we're actionable, and so a bias toward action. So that's how the teams will be set up in the future, is really focusing on what actions and what can we influence and move on together as a team. collaboration. And really, I think that's such a word that's overused. And the definition is really powerful and about what collaboration means here. And it's about accountability as well. And we'll also send these out to you again after the meeting today, the definitions. Relationship and strengths focused. We're hearing a lot that is not strengths focused right now in the community, and we want to leverage the power of all of the individual agencies, organizations, and people in this community to drive action forward. And then joy and celebration. So really taking a look at the small wins and what we're doing well and what we can celebrate as we move forward. We can flip to the next slide. We have some proposed structures about what RGN could be and should be in the coming year. So we are looking at this as an action group together. That we heard that from you. We want to work together. We want to problem solve. We're proposing working sessions once a month from 11:30 to 1 p.m. And we would break out into the action teams within that time and share information together as well. So it will be the first Wednesday of each month. And we ask you to hold that time from 11:30 to 1. Our goals are to consistently learn across teams and to plan together and to execute and implement on goals for each of the action teams. I'll show you what those teams look like in just a few minutes as we are planning to get into teams today. Families as part of each action team. So making sure, again, that family voice is embedded and that we're hearing from people who are most impacted by the work in our communities. And then a leader of each action team as well. We don't have those leaders named yet, but we will have a process for doing that. Part of this work will also be seeking funding to make sure that this work can continue on as we are moving forward. And we have some plans for that we'll share with you. And then an executive council of RGN. So a network of community collaborative leaders so that decision makers at all levels in the community are engaged in this work. And that is a council that will need to be developed. And it's to bring together folks who are working on lots of different things and doing systems work as well, and make sure that everybody is talking to each other, that we're bringing up gaps in the system that we're finding as we're doing work together to build a more resilient Guilford County. If we can move to the next slide, please. So based on the work that was done during the last several sessions and what we know collectively about what's working in other communities that are doing system work, these are the proposed action teams. And I'll ask you to just pay attention to them. We'll give you a high level overview and then talk a little bit about some proposed goals for each action team. So the first one is public awareness, outreach, and strategic communication. Then the trauma provider network, which are partner agencies that have MOUs to do resource coordination and gap identification and really gap filling and to lift up what this community needs in order to become a more resilient community. Training and technical assistance. So as Kelly said, this isn't an either or proposition. The trauma-informed piece of this work is critical if we are going to move forward together. And so really understanding what the needs are across the community so that we're all on the same page about what we're doing together. Fourth is policy and advocacy. So we know, and we've seen this over the course of, I think, especially the past 2 years, about the importance of having policies that align and support resilient communities. And so this action team will focus on policy and advocacy with other partners in the community. The fifth is shared measurement for community resilience. There's a lot of conversation happening at the national and state level about how we measure resilience as a community if we are building more equitable systems. And so we'll bring that work into ours as well. And then identifying funding structures to support the ongoing work, both public and private. So numbers 5 and 6, we're not going to work on today. Those will be a little bit later, but today we're going to focus on 1 through 4 and ask you to join breakout groups. I'm going to give just a little overview if we move to the next slide. About potential goals. And these, again, came from your comments the last time we were together, and what is needed in the community. And we thought about this in a few different ways, and I'll share this with you. So public awareness, outreach, and strategic communication, that group 1, really about building common language. So what is it that we're talking about here, and build understanding about what trauma resilient communities look like. Building out the PACES Connection website for the Resilient Guilford Network so that it can be a learning space for all of us, and that it's a place that is helpful in terms of what we are doing together here in building a resilient community. And then developing and launching a public awareness campaign around resilient communities. You'll see the second group, proposed group, is the Trauma Provider Network, Resource Coordination and Gap Identification. So it's participation in the Trauma Provider Network to develop a coordinated community response, share resources and information. Building linkages to other local efforts focused on coordinating services. So we know that a lot of people, I think at one count in our community, we had something like 50, this was a few years ago, 56 different guides for referrals. And so how do we coordinate? How do we connect? How do we not duplicate work and make sure that we're building linkages and leveraging the collective knowledge of this community? And evaluating local data to understand emergent needs and develop strategies to fill gaps. You lifted up several of those during our last meeting. Some of them were around our immigrant and refugee community. There's concern about that community in particular, which has already experienced significant trauma, and wanting to make sure that we are connecting resources to better serve. And then also, I think we also really focused and keyed in on substance use and the rise in that. So looking at the data, what is happening in Guilford County? How do we respond to it collectively? The third area, if we can flip, is really on TA and technical assistance. And so some of the goals that were laid out is, what kind of training is needed? What do we need to do to prevent secondary trauma? And then what kind of guidance is needed for evaluating and developing trauma responsive programs and systems? And then finally, last but never least, is the policy and advocacy piece. So connecting with existing policy groups and promoting the adoption of trauma-informed policies and practices at the local level. So what can we do organizationally, system-wide, and with our policymakers to ensure that what is happening in our local community is trauma-informed? I'm going to flip to the next slide.
Hey, Mary.
Mm-hmm.
Valerie Jones has her hand up.
Oh, hi, Val. Hi, Valerie. Would you like to, do you have a question?
I'm sorry, that must have been that's a technical difficulty thing.
Oh, sorry to put you on the spot, Valerie, but I'm so happy to see you and to know that you're here.
Oh, thanks for being here. Sorry about that.
No problem at all. No problem. We're going to skip through the slide in the interest of time, but you'll receive this deck after. So it talks about the measurement and the funding structures for supporting this work. And we're not going to address that today. We did want to call that out to make sure that you all know, because it came from you, that this is something that we need to think about. Okay, if we can flip to the next slide. Okay, so we are going to do some breakout groups, and I hope that everyone in this team is found something that they are interested in these 4 groups. So we're going to ask you to self-select, and my apologies for the wonkiness of the slide. So 4 groups, And we have a series of questions. They're going to each be facilitated. So public awareness, outreach, and strategic communication will come with me into a group. TPN, the Trauma Provider Network, will be with Lisa and Melanie. Training and technical assistance will go with Kelly, and policy and advocacy will go with Michelle. So what we're asking you to do is to pick one group. We're going to vote with our feet and actually our fingers. So you're going to choose a group that you want to be in. And I'm putting in the chat right now the questions that we're going to address. So each group is going to look at the goals that we just went over to say, yes, this is what we want to work on together for the next year and into the future, or here's what needs to change for 2022. Here's what else we need to think about. So it's really your time to look at the goals that are proposed and to say yes, no, and to spend some time with it, with those as a group. Then we're going to meet for, I think we have about 20 minutes in breakout groups, and we're going to come back together and do report outs about what each group would like to see change, would like to modify, that kind of thing. So we've done this every step along the way for the past 4 months about doing work in collective groups and then reporting back out. So it's what we have been doing in terms of practice. So any questions about this? Leland is getting ready to put up the groups that we will go into, but what questions do you have right now, or any clarifications from the Kellen team about what needs to happen?
Just one clarification. So if you've been part of the Trauma Provider Network in particular, you would want to select group 2.
Okay, any questions? I'm looking in the chat. Is everybody clear about what we do next? Can show a little wave of hands. You doing okay? All right. So Leland is going to, fantastic. I see LaMonica put in group 4 to be assigned into. Fantastic. Everybody's going to have the opportunity now. And Leland, are the groups up? And you can just click on the group that you want to be part of.
They should be up. Are you seeing them?
Can everyone see?
Yeah,
I
it looks
see
like
some
people are
folks,
starting.
yeah, some folks are starting
You
to
need-
join.
I think you need to hit breakout rooms down at the bottom. If you click on that, it will let you join.
Yep. And if you don't see it and you want to put it in the chat, then I am happy to assign and send folks as well.
And this group selection is just for today.
And Charlene asked a question about group selection is just for today. We want to make sure that we give you the opportunity to think about that. So participation is for today, and we hope that you will want to be a part of one of the groups going forward as well. Okay, is everyone getting into the groups that they would like to be in?
Carol, do you have a preference for a group? Group 2. Okay. There you go. Hi, Lisa.
Hey, I'm so sorry. I just picked up the email of the new link.
Oh yeah, no problem. Sorry about that. We just joined into breakout rooms that these are what the rooms are. If you want to join into one, you'd have about 15 minutes in there still.
Okay. Do you have a suggestion or a place where you think I would be most helpful?
So number one is more about just public awareness of RGN and resiliency efforts in the Guilford County community.
Okay.
Group two is more our provider network and identifying resource coordination and gaps. Three is training and technical assistance. And then four is policy and advocacy. I think you would probably be more interested in group 3 or 4.
Okay.
But it's totally up to you. I can zoom you into whichever one.
Yeah. Let's try group 4.
Group 4. Okay, you got it. Hi, Shep. It's nice to see you.
Likewise, nice to see you as well. How you been doing?
Good. How about you?
I am doing well, thank you.
Good.
I told Kelly I'll be touching base with you folks soon. I have some things going on, and so that's about ready to come to an end. And
Yeah.
yeah,
Awesome. Yeah.
y'all keeping busy over there?
You know it. Never ends.
You guys do great work.
Oh, well, thank you.
Welcome.
Well, we will be bringing everybody back here shortly.
Okay.
Just take a moment to pause.
Okay. Excuse me. Put on mute.
You rocked it, Leland. Our group kicked butt. We only had 3 people too, so it's helpful to have good, because discussion can go pretty quickly when you're a small group.
Exactly. Yeah. Well, I just sent the message, so everybody should be coming back here in just a minute, about 40 seconds or so. Oops.
Okay, welcome back, groups. It's great to see everyone. Do we have representation from all of the teams here? Everyone should be back. Okay, excellent. We're going to do some reporting out. How did that go in the teams? Just a general thumbs up, thumbs to the side, thumbs down. Can you show me or if you're off screen, thumbs up? Okay, good deal. All right, excellent. So we had 4 groups doing some excellent work and ready to hear from them. So we're going to start actually with group 1 that was focused on public awareness, outreach, and strategic communication. So I think, Brandon, we're going to turn it over to you as the note taker and reporter outer.
Okay, so what we did and discussed is the goals that we had last year. Were they effective, or do we need to change or alter any of them? I know for a few of us, we said that the common language and understanding what it means is one of the big keys, especially just having a foundational aspect of what it is to contact those who are not knowing of what trauma-enforced resilient community is, or just trying to start from the ground up, meaning what is the task force, or what is a group that we need to really get out there and start talking to. The first one was legislator. They have the higher power, they have the higher money, but they don't really understand, or they just are nonchalant when it comes down to certain trauma. I'm not saying a lot of legislators are, but there are probably certain groups that don't know or understand it. Another group is the faith community. You know, when they help those, they help in empathy, but also they can have more information of learning and knowing what the traumatic experiences and how to have a resilient community. And the same thing with early education, because it starts from the youth. And it's the same thing where we put people, or excuse me, put children in different foster care or DSS or CPS, or heck, even fatherhood. They go through some traumatic experiences as well, and they don't talk about it as much. They will probably express it in a different way, but they're not going to really say it as what they should. So those are a couple of the big focuses that we would have. And then it's the same thing as just far as trauma in our different aspects of the world and what we do might be different from somebody else's. A medical traumatic experience might be very different from a therapeutic, or it might be different from other different aspects of the community on itself. So it's just trying to grasp what the basic language is and what we need to work on. But as far as any changes, I don't see anything of sort, just other than just building up the, like I said, the task force of what it means to bringing more of the community involvement and just showing that out.
Thank you so much, Brandon. Really appreciate that excellent summary. Anything else from the team to add before we move to group 2? Okay, round of applause for group 1. Y'all did a great job. Fantastic. Okay, so a little birdie told me that Paige from the Children's Law Center is reporting out for group 2. So Paige, we're going to turn it over to you to hear about the trauma provider network and resource coordination and gap identification.
Okay, so we're just doing the first question, right now, or?
Actually, as far as the group got, yep. So
okay, so go through all the, okay, sounds good. So in regards to whether these are the right goals, so the group agreed that we are going in the right direction and a lot of people are engaging in the services, but there are still gaps, which I think, you know, that's one of the focuses of why we are here. And that we do need to find out who is doing the work and what they are doing. And it has been a little bit difficult due to the pandemic. A lot of things have changed. And then obviously just trying to build up this network of people. So there was a suggestion that each of us in the group and, you know, maybe in the larger group as well, think about who we network with and what organizations we work with, what people might be good to invite to this group and include to broaden our network. And in doing so, that it would be helpful to have a write-up of, you know, this group and what the focus is and what the goals are to help spread the word. We also talked about getting the information that we're gathering about our networks that we all individually have and creating a database so that we can, you know, see who all we have and who we might want to invite. We talked about at the next meeting, being able to have that list from each of us to bring to the table, and perhaps at the next meeting, being able to share changes within our organization, updates, other needs that have arisen within the community that we may not have already talked about, what's new and happening within our own agencies, if there's new protocols, procedures, new staff, if there's been turnover. The suggestion was also made for continuing meetings to possibly have a time for a success story to try to highlight something positive, you know, that has happened, just given that a lot of the work that we do, you know, can be difficult. So to bring something positive out of that, and then also possibly to bring some additional presenters into the meeting, whether it's people from our own group that are providing some information or training, or bringing a special guest in that also would provide some useful information to the group. That's what I've got.
Fantastic. Thank you so much for the really in-depth report out. And I just want to lift up how action-oriented. There's some comments in here about action steps already for before and for the next time that we meet and do this work together. So thank you so much. Any questions for group 2 or comments before we move on to group 3? And a big thanks to Paige for holding it down from Lisa. All right, so let's move on to group 3. And I'm not sure who we're hearing from, but we're talking about training and technical assistance in the group that was facilitated, I think, by Kelly. Who is
Darlene is up. And we decided that providing community training, supporting the helpers to prevent secondhand trauma, and providing guidance for developing trauma-informed communities was the right goals for the group. We said we should consider adding resilience high point, change often, the mental health organizations and nonprofits, and Guilford County Guilford System of Care, GTCC, and the YW and the YMCAs to the group. And then we said we would start with the CRM trainings because Resilience High Point is already committed to doing 3 this year. And the Callan Foundation, RGN is committed to doing some trainings. So we thought about getting a roster of all the trainings that are going on, and then building a list of all the facilitators and trying to coordinate the effort, and everybody like push the one message across all the different networks, so that the whole community would know what all is available to them in terms of the community resilience model training. And we said for the next meeting, it would be helpful to have that roster of facilitators so we could begin to contact them and see, when they're offering trainings, and get this master schedule going, and have the list of the organizations, like the mental health organizations and things, so we could start contacting people.
Fantastic. Another really action-oriented piece. And one of the things I just want to lift up, Charlene, is, the connectedness with Group 1's work about public awareness and the trainings as well. So as being silo breakers, as you all are on this call, we'll want to make sure that this work is coordinated in collaboration with each other too. So just wanted to lift that up. You were living out the values, Group 3 of this organization, of this, not organization, but this, this network. So really appreciate that. And speaking of advocacy and policy, we have Group 4. Is there, who is the representative speaking on behalf of that group?
Yeah, I'll be speaking for that group, and group members, please jump in if I miss things. So when we talked about the goals, we all were pretty much, on board with the goals as they were. Some ideas that were just added to it. Let's see, so it's important to connect with existing groups that are doing policy work, working with the school system here, as far as definitely promoting trauma-informed policy and procedures, establishing a flexibility with the policy adoption, and knowing that a lot of policies and procedures are dynamic and things can change, especially during this time. So making sure that we're flexible. Engagement and an accountability process for elected officials and candidates. I know that working with elected officials and candidates can get a bit wonky, but we want to make sure that we are establishing ourselves in the community so that they know that our recommendations are not something to be glossed over, that we have a large enough network that it would behoove them, if they want to be elected, to engage with us. And then also, we want to make sure that we're working closely with the other teams here, especially the public awareness team, to ensure that we have common language, that we are directly addressing impacted communities, and that we are making sure that we work through a lens of educating and empowering impacted communities to be involved with the work, and also just to branch to their own and inform their families and neighbors, and really wanting to get involved in the process. Oh, and then it's important, and one of the things we want to add as far as a goal is to make sure that we have constant representation from impacted community members, especially youth. So we want to make sure that they are always a part of the conversation. As far as who needs to join in the work, of course, youth and families, schools, the Guilford Child Advocacy Network, faith community, grassroots community groups, especially those that represent impacted folks and folks that do intersecting work. And then I have also recently formed an organizing collective with some folks that have different networks, including Kenya Donaldson, who is president of Guilford County Association of Educators. So I want to make sure that we connect with her as far as the education lens. How do we engage? We want to make sure that we're normalizing just protection, mental health, boundaries, a come as you are type stance and policy. And as far as action steps, we're going to get some more information on Guilford CAN and NC Child's standing policy recommendations, making sure we have a list of organizations that we're going to be connecting with, and then we're going to start making those connections before the next meeting. I really hope I got that right.
Wonderful summary, Adrienne, and I loved the again connections to the other groups and the recognition that's going to take some work in between meetings too. Did the group talk about how that can happen? I think actually all four of the groups lifted that up as something to share. Were there any specific plans about how to do that that were lifted up? I don't mean to put you on the spot, Adrienne. Anyone is welcome to answer that.
I hadn't gotten that far.
Yep. Okay.
Well, I can definitely, I know that a couple of us are already connected with Guilford CAN, so that helps. Yep. And then I'll be reaching out to Kenya and seeing, just touching base with her with regards to this.
Okay, fantastic, Adrienne. And Kenya spoke at one of our earlier meetings this year too, on one of the panels, and just did a phenomenal job. So excited to engage educators in this really important space. Okay, we just have a couple of minutes left. Anybody have any questions or anything that you want to raise that was not raised so far in this group? Everybody did fantastic work. Give yourselves a round of applause, and the presenters. Not an easy task to do, but really grateful for that. Any questions for the group? Okay, all right. So what's next? So you will receive notes from today about what all the groups work, the work that happened in the groups, including your own, along with some next steps that the groups might take and what information will be needed for the next meeting. We will meet the next time on February 2nd from 11:30 to 1 p.m. A good portion of that time will be meeting in the groups again and continuing our work together. In between now and then, think about some of what we learned today about who else needs to be at the table, and we invite you to invite someone else to join in this important conversation so that their perspectives are heard. Really excited about the work that was done today. Any other announcements for the group and for the good of this network before we adjourn? We have about 3 minutes.
One just quick note for those that have historically signed in with the Trauma Provider Network, you'll notice that this our RGN network is still this first Wednesday of every month, consistent with that pattern that we've had. It's a little bit extended, and so the TPN Action Group will work within the RGN network so that meeting structure stays the same as it has been historically for those that are primarily joining connected to the TPN work.
Thanks for that clarification, Kelly. Should have said that earlier. Okay, anything else for the good of the group? Okay. Thank you all for such an energizing session together. Be well. You will see notes coming out very shortly, and thank you all for the excellent work today. And we will continue on in February together. Okay. Thanks, everyone. Have a great day.